everybody, I'm Becky, owner of Kimberly Bodywork and KB Athletics. Today we are going to be working with hip and knee flossing. We're going to go through all three planes of motion. So we're going to do sagittal plane, frontal plane, and then transverse plane. Okay. If you look through some of my other videos and playlists, we've already done cervical spine flossing. So that's for the neck, loosen up the neck joints, and we've already done foot flossing. So now we're going to work up the chain. We're going to address the knees today and the hips. Okay. So first thing we're going to do is put our arms up over our head. We want to make sure our armpits are facing forward and our elbows are facing to the wall. Okay. We're going to be in that position. Nice and tight, active shoulders. Don't let the shoulders shrink. So you can think about maybe pushing up into the sky or onto the ceiling that is above you. Okay. And what we're going to do first, we're just going to flex our hip, and then we're going to extend our hip. We're going to flex and then extend. When we are extending our hip, we want the hip completely straight or extended, knee completely straight and extended, and I'm kind of back on my toes. I don't want to be back here. Okay? So we're just going to go forward and back 10 times. So I'm flexing, extending, flexing, extending. We will then do the same thing on the other side. Flexing, extending, flexing, extending. On my right foot, the leg that I'm standing on, I have a very strong tripod foot. So I'm rooted into the ground. Okay? We also want to make sure when we are extending, we're not extending through the ribs. Okay? We want to keep our ribs stacked on top of our pelvis. Okay, good. From there, we've already gone forward and back. So now we're going to do the same thing, but it's going to be side to side. Okay. And same thing, hips extended, knees extended, ribs are pulled over top of pelvis. So my ribs never flare. And I still have my nice active shoulders, okay? Remember with the joint flossing, you're going to do anywhere between 7 and 10 repetitions, depending on where you are at with your comfort level or your nervous system, okay? Now, from there, we're going to do the same thing. And if your arms start to get really tired and this is too much for you, you can always bring your hands down to here. So we've already done forward and back. We've done side to side. Okay, now we're going to do a circle. So I'm going to rotate out, come up, in, down. Rotate out, and then down. So if you want to use your knee as a guide, my knee is coming up, knee is coming in, and then down. So I'm landing slightly internally rotated. External rotation, come up and down. This leg, my left leg, I have a nice active grounded foot. I am in my foot tripod. And again, we have clockwise and counterclockwise, so now we have to reverse the direction that we already did. So we had already done in, now we're going to come in and go out. Okay. So again, using my knee as my reference point, knee is going out, in, out. Good. And we have both legs, so guess what? We have to do both legs. So I'm going to start in, come out, in, come out. And remember, 7 to 10 reps. And also remember too, if this doesn't come easy for you, that's okay. Sometimes people have to work many weeks and months to be able to do a lot of this stuff, okay? Then we're going to go out and then in. So we're just reversing the exact same thing that we already did, okay? And again, 7 to 10 reps, okay? Good. after that now, we are just going to keep our feet together and we're going to do circles. So again, I'm going through hip flexion, so my knees are bending, knee extension, knee flexion, knee extension. Okay, so I'm making little circles. And yes, my feet will have to move. You can feel how they're both going into pronation, supination. Switch sides. Okay. Again, 7 to 10 reps. Good. Now we're going to work on our balance a little bit more. We're going to do something called hip pendulums. All right. So we're going to stand, tripod foot on my left, other hip's going to come to 90 degrees, and we're just going to pendulum from our knee down to our foot. So instead of trying to control the motion like I'm doing, I'm really just allowing the bottom part of my leg to be loose, kind of like a pendulum. Okay? Same thing on the other leg. So hip flexion, grounded, rooted tripod foot, and allowing my foot to be loose and floppy, and a pendulum. Okay, and you'll feel your knee and your hip kind of go in and out into external rotation. So we've done forward, now we need to do the same thing but out to the side. So I'm going to lift my leg out to the side and do a pendulum. Okay, again, 7 to 10 reps or wherever you're comfortable. Same thing on the other hip. Good. All right, so we've accomplished hip flexion and extension. We've done abduction, abduction, and adduction. Okay. We've done hip circles. We've done hip circles. Alrighty. We've done hip pendulums and hip pendulums. All right. Now we're going to do a hip and knee figure 8. So I like to use my toe. It's kind of my reference point. So you're actually going to use your toe to draw a figure 8 or an infinity, however you want to look through it. So you're going to make sure we start here. With my toe, I'm going to draw figure 8. So my knee is bending and extending, and my hip is rotating in and out. And then, of course, we have to go the other direction because we have clockwise and counterclockwise. Okay, and then we'll do the same thing on the other leg. So I have a nice, strong, stable tripod foot. I'm going to start in hip flexion, point my toe, use my toe as my reference. I'm going in first. Good. And then we're going to reverse the direction. So I had already gone in this way, so now I'm going to go whoop the other way. I'm going to go out then in. And you will find a lot of times one side's harder than the other. Maybe forward is easier, out to the side's harder, more from a balance standpoint. Again, this is giving you clues as to what could potentially be going on either in your body structurally or what your nervous system is happy with. Okay? Now we're going to move up a little bit higher into the hip and a little bit of pelvis. You might see this in the pelvis and the rib cage flossing video that I'm going to do. So what we're going to do, stand up, feet about like you're going to squat. So shoulder width apart, not hip width. Okay, we're going to be shoulder width. And then I'm going to just take my hips side to side. So I'm going in a frontal plane. Okay. So like right now I'm feeling a little something in this left hip. Like I just don't have all the motion to go over on that side. So if I was treating myself, I would stop and figure out where exactly that little hiccup's coming from. Piriformis over here is not too happy. Good, so we've gone side to side. Now we need to go kind of front to back, okay? So what we're going to do is kind of go back and forward. So you can kind of feel how the hips and the pelvis are kind of gliding, kind of like my hands are gliding. Okay, I'll show you from the side. So there's a little bit of forward and back motion versus side to side, what we just did, okay? Good, and again, 7 to 10 reps. So that concludes all of the knee and hip. So far you guys learned how to do your feet, you've learned how to do knee, you've learned how to do hip, and you've learned how to do your neck. I still have pelvis, rib cage, and then shoulder, wrist, and hand. So those will be coming very shortly. For now, just take time and move on the progressions that you can do for right now, all right?